Good morning or good afternoon. And I want to thank you for taking a moment to watch this very important video. The word unprecedented has become a part of our vocabulary in the last few weeks as we've watched our nation and literally our world navigate the coronavirus or COVID-19. This is a perfect time for the church to shine. Historically, the church has risen to the occasion whenever we faced a crisis. And so this is a time for us. It's an opportunity for the church to speak hope in the lives of people who are discouraged. It's the opportunity for the church to speak peace in the middle of the storm. It's the opportunity for us to be the hands and feet of Jesus. And it's the opportunity for us to literally live out our faith. So this is a disease that has impacted organizations of all kinds, and the church is no different. The church, as you and I know it, is being impacted by the disease and the effort to curb its spread. So we're used to gathering on Sunday morning or throughout the week. But on Sunday, the governor of South Carolina issued a really strong recommendation that gatherings be kept to 100 or less. And that was soon followed by the CDC, who recommended or advised that it be 50 or less. And most recently, our president said that gatherings should be kept to 10 people. So in response to those strong recommendations, your church board met on Monday evening for 2.5 hours, and after prayer and gathering information from healthcare professionals and discussion, we determined that the best plan of action was to move to an online format for the next 15 days, and which begins this Wednesday evening, March the 18th, and will take us through March the 31st. Now, I know those are difficult words to hear, maybe difficult words to understand, and I can assure you it was a very difficult decision to make. And you're probably asking, so what does that mean? Well, it means that we're going to have church, but just in a different format. We're not going to gather in a building like we typically do. But our plan as it stands today is to provide live streaming of the Sunday morning service that will include music, live streaming of a Bible study on Wednesday night, a recorded Sunday school class, and a recorded message from our youth pastor, and some online activities for our children. So that's our plan as it stands today. As you know, this is a fluid situation, so things can change, but that's our plan today. So again, this really provides us with a unique opportunity to be the church. Now, the decision to make this move to online format was not an easy one, and I'm very grateful for people who have surrounded me and the church board in these days to make that decision. And tonight, I'm very grateful that some of those folks have joined me with Susan Gaiman and Tina Simons and have really been great partners in this. Susan, I got to tell you, as a pastor, the hardest decision I've ever made was to not have church. But tell us why that's the right decision.
So what we know about the coronavirus is it is a virus that is affecting people's respiratory system, meaning it is making it difficult for people to breathe. People can have from very minor symptoms to very severe life-threatening symptoms. We also know that it is passed from person to person, and it is extremely contagious. So being around people makes you very susceptible. If they cough, even sometimes just breathing, you can become exposed. We also know it lives on surfaces. So you can go somewhere, open doors, touch tables, and the virus can still be alive on those surfaces that you're touching. And then if you touch yourself, especially your face, your mucous membranes, then you have become exposed. So the hope is that if we lessen our contacts with each other, that we can stop so many people from being exposed. So again, the goal is 15 days to slow the spread, and the hope is that people will still be exposed, but in smaller numbers than what other nations have experienced. So we want to stop that peak that China, Iran, Italy have experienced, and so that people may be exposed and may be diagnosed, but it'll be a smaller amount of people steadily along so it doesn't overwhelm our healthcare system, and so that each person can have the healthcare that they need to be able to recover timely.
So the 15 days is not some arbitrary number. It's a medical number that we believe will help stem the spread.
It will. So the evidence shows if you're exposed, You should have symptoms between 2 and 14 days. So that is why the hope is if you have no symptoms on day 15, that you are no longer contagious to anybody else and you did not contract the virus. So again, the hope is if you stay home for 15 days and you're not exposed, then you can't go out and expose other people.
So as a healthcare professional, what would you say to people like me who are 60 and above?
I'll give you the advice everybody else is giving. They're telling people to stay home as much as possible, to wash your hands continuously, try not to touch your face, and that's very hard for some of us. Try to limit your exposure when you go out to times of days that are not as crowded during peak times. Go to the grocery store early in the morning. Try not to be, again, in crowds. They say it's okay to eat out, except for you have to go through the drive-through and take it home. So it's just eating out, like you said, in a little bit different way than what we've done in the past. They're also saying get rest. Again, try to reduce our stress loads. Be prayerful rather than fearful. Drink plenty of water, stay hydrated, eat as healthy as we can, and just try and take very good care of ourselves.
So I want to just say in closing that this is not a time to be afraid, but it's a time to put our trust in the Lord. And so finally, Susan, I want to ask you, as we put our trust in the Lord, how can we pray for the healthcare profession?
I think that is the biggest thing we can do for the healthcare profession is to pray for all the healthcare providers. Healthcare providers need strength. They need encouragement. They need God to take care of everybody. They are being exposed every day, bringing home the exposure to their families possibly. So we need to support them the best we can, work together, and the community will get through this, and we'll keep the community safe together.
Good. Hey, I want to say in closing, take these next 15 days to serve other people. Don't park your faith, grow your faith. You'll be receiving things from us over the next day or two that give you opportunities to grow your faith, participating in a prayer proclamation from our mayor. You'll receive a message of hope every day from me. And I also want to remind you to be faithful to give online. You've been faithful in the past. Continue to do that. You can give online. You can come by the church and drop off your offering, or you can do it the old-fashioned way and mail it.